Hello, good afternoon everybody. This is Dr. Girish Kumar. I am a pediatrician from India. Basically, I am going to discuss a case of my own family member, that is my mother, who is most probably suffering from chronic renal failure. So I will like to discuss this case with uh, among the medical perfectionists and those who can give me the sincere advice and suggestions on how to manage the case. So I would like to discuss from the beginning. So here I start from the basically the case sheet about the patient's record. So my mother, she is of the age of 61 years, and for last 15 days or so she had been presenting with history of swelling over the lower limbs as well as on the face, covering the eyelids mostly. So she has been suffering from a sort of generalized edema, I can say, okay, for last 15 days also. And before this she had been suffering from high blood pressure for last 2 months or so, and she's been under treatment for that. Okay. Then beside the generalized swelling in the lower limbs and face, she has been complaining of lot of fatigue even while on getting up from the bed in the morning after the sleep. Then also she complains of great fatigue. She does not even like to get up from the bed, can't even walk for a few steps. So beside this chronic fatigue, she has been complaining of connective tissue disorders, like she had been complaining of pain in the joints, mostly in the lower limb joints, knee joints, I can say. Right knee joint is more affected than the left. So she has been complaining for last 2 to 3 years. And, it was a complaint of pain in the knee joints. She was unable to walk and climb and down the stairs also. For this she had been taking opinion from the orthopedician and had been taking medicines like calcium, vitamin D's and some painkillers, analgesics like COX inhibitors, cofecoxib and celecoxib. Celecoxib has been recently started for last 1 month, and cofecoxib she has been taking for last 2 years or so. So this is a treatment history about the joint pains. And about high blood pressure, basically she was getting severe headaches and giddiness and drowsiness for last she started complaining of, we came to notice only 2 months back, and she was complaining of these complaints like headache, giddiness, drowsiness and generalized weakness, throbbing pain in the head, mostly in the temporal regions, pulsating pain basically. So when we undergone her BP, blood pressure, so she was showing around, BP was around 140 by 190, 140 by 90, or sometimes 150 by 100 also, which never used to be before this. Before this, whenever we used to check our blood pressure frequently in the house only, then it used to be around 100 by 60, 110 by 70. It was on the lower side, or we can say it was normal to her level. So now it rose to 160 by 90, 150 by 90, 160 by 100. So we started her on atenolol, basically MTAS 80, atenolol and amlodipine 2.5 mg and atenolol 25 mg. She was taking once a day, and And for orthopedics, as I said, she was taking celecoxib for last 2 months and rofecoxib for last 4 or 6 months for the joint pains. That was under the advice of orthopedic surgeon. So now, for last 15 days, she had been complaining of generalized swelling in the lower limbs and on the face, which she noticed 15 days back. And yes, in the past history, yes, again, she had complained of getting, means while doing some domestic works at home, she was alone and suddenly fell down on the floor and got unconscious for 5 to 10 minutes. She doesn't know how much, basically. This is an idea. She got unconscious for 5 to 10 minutes. She got totally blackout and again regained the consciousness with generalized weakness. Somehow she managed to go to the bed and relax over there while holding the walls of the room. So this is one episode of this. And beside this, if we still go in the past history, some 1 year back she has been operated for gallstones. Okay, operated for gallstones, and she has been undergone cholecystectomy for that. Okay, and then we still go into the past. Just before the cholecystectomy she has undergone, she was complaining of chronic pain abdomen in the epigastrium, bloating of the abdomen, pain in the epigastrium, bloating of the abdomen, and which usually shifts to the this pain usually used to shift to the back and the spine and as well as to the flanks. So at that particular time, when she had these frequent episodes, we had undergone certain investigation. That time she also complained one more thing, which was very unusual. She used to say that she was getting red colored urine. So when I had undergone a urine test, whenever, I think twice or thrice, that time she was absolutely normal. The urine was absolutely normal. There was no RBCs even, not even a single RBC. So we used to be surprised. And I think I had undergone some X-ray, KUB, also kidney urinary bladder X-ray, plain X-ray, and that X-ray was absolutely normal. There was no obstruction, no calculus in the renal system. We just kept quiet, could not think of anything else. But our main concern that time was for the gallbladder stones. So we undergone certain investigations, basic investigations for surgery, and that time her serum pancreatic amylase was very high. So she was given some digestive enzymes by the surgeon for 2 or 3 weeks, and again she was called back for re-enzyme test, and when it came to normal, and she was operated in last year in April 2008. So this was the past history, and there is no any other significant history in the past so far. Yes. Now if we come to the presenting history, as I told you again, she has been suffering from swelling in the lower limbs, including the both ankles and feet, and swelling around the eyelids, face, cheek, and so on and so on. So now since she is living away from me, not with me, when I heard about this on the phone, I called her back here in the city where I live. So I had undergone certain investigations for her, which was again surprising to me.